So today I'm going to talk a little bit about my work on the retinal oximetry in COPD, or chronic obstructive pulmonary disease. As we know, the retinal arterioles, they allow direct and non-invasive observation of the arterial blood in central nervous systems. So the retinal oximetry technique may have advantage over peripheral pulse oximetry measurements in certain patient populations, such as cardiovascular shock patients and in those who are critically ill. We know that reduced cardiac output, it decreases the oxygen delivery, and the blood flow becomes compromised to lower priority organs, whereas the circulation to the brain is preserved. Pulse oximetry, or peripheral pulse oximetry, it depends on pulsatile arterial blood volume. And I, as a certified registered nurse anesthetist working in the anesthesia care unit and in critical care, as well as it is well known in the literature that peripheral vasoconstriction makes it difficult to obtain pulse oximetry measurements from tickets or the air lobes, because the pulse oximetry, it depends on pulsatile arterial blood flow volume. So, and during severe hypoxia, the pulse oximeter measurements, they also become less reliable, and acute arterial hypoxemic changes, they lag behind arterial blood gas measurements of the blood oxygenation. So our purpose was to test the capability of the retinal oximetry to detect systemic hypoxemia and to detect the effects of supplemental oxygen on oxygen saturation in retinal vessels. Our patient group, it consisted of 11 patients with severe chronic obstructive pulmonary disease dependent on long-term oxygen therapy. The mean age was 70 plus minus 5 years, and we have 11 age and gender matched healthy subjects as a control group. I'm not very skilled with technology. Okay, so these are the results on the measurements of COPD patients. Here is while they were breathing, their prescribed oxygen on arrival. Here is after 10 minutes of ambient air breathing. And as we can see, the oxygen saturation is significantly lowered in both retinal arterioles and finger oximetry. However, the oxygen saturation did not decrease significantly in the venules, although there's a tendency for decrease. And the AV difference, it did not decrease markedly either. And you see here after 20 minutes of recovery breathing of oxygen, the oxygen saturation in both the finger and retinal arterioles approach towards the normal baseline value, or not normal, but the baseline value. So there was no statistical difference between time 1 and time 3. Of retinal arterioles with the radial artery and finger measurements. And as you can see, the retinal arterioles, they showed lower values than the radial artery and the finger. Both retinal arteries and retinal veins are hypoxic compared with healthy subjects, and the retinal arteriovenous difference, it was not markedly changed between both these groups. And here, of course, there is a decreased oxygen saturation in the finger and as well as in femoral artery blood gas sample. And according to his results, the retinal artery oxygen saturation measurement, they correlated well with both finger pulse oximetry and the femoral artery blood gas measurements. So in conclusion, the retinal oximetry, it detects hypoxemia of retinal vessels in patients with systemic hypoxic diseases. And the retinal oximeter is sensitive to oxygen breathing. And with a handheld oximeter, retinal oximetry could be useful in any acute care setting, such as intensive care units, operating rooms, emergency departments, and out-of-hospital acute care. So it's a question where we are heading in the future. Thank you.
So, thank you for this presentation. Any questions, comments from the audience?